Hello from the Advanced Therapies and Regenerative Medicine Congress 2019 here in the Business Design Centre in London. And I'm joined by Dr. Stephen Badylak, who's Deputy Director of the Mcgowan Institute for Regenerative Medicine in Pittsburgh. Tell us what the Mcgowan does.
The Mcgowan Institute is centered entirely around regenerative medicine. It was formed about 20 years ago, highly interdisciplinary. Our goal is to advance whatever therapies, be they cell-based, biomaterials, whatever, to treat diseases that currently either have no therapy or poor therapies. We've been doing that for 20 years, 25 years.
What's on your immediate radar at Mcgowan?
Well, there's, on my particular radar, there's a couple of imminent clinical trials. One's in for esophageal disease and another for musculoskeletal disease. But I'm just one of many faculty, so everybody's got their own little areas of interest. We've got experts in liver disease and treatment, cardiovascular. I mean, literally every body system's covered. But my particular laboratory currently is closest to clinical translation with an esophageal product and a product for severe muscle injuries.
What are the big challenges that still face regenerative medicine?
I think there's two, actually, at least in the clinical translation part. The basic science is making terrific advances, but taking those basic science discoveries and turning them into something that will benefit a patient is a different story. The first, and there's no particular order because I think these are both equally important, is education of the caregiver. The whole idea of regenerative medicine is that let's call it the usual way of practicing medicine for the past, let's say 100 years, hasn't solved certain problems. As a matter of fact, we've had very few advances in some really serious things, spinal cord injury, stroke, most types of cancer. So the idea is let's take a fresh look, entirely different way of looking at the disease and ways of treating it. So stem cell therapy and gene therapy, a lot of things being talked about at this conference are good examples of that. So that part's advancing terrifically. One roadblock, though, is that when it comes to delivering it to the patient, I think there's a real shortcoming in the education of the caregiver. You know, physicians all over the world are busy treating patients every day, doing what they do well. And so you come along with something that's markedly different, and unless they understand the biology behind it, they're not going to be able to effectively deliver it. I think this is one of the problems with stem cell therapy, for example.
And of course, it's all so new.
It's so new.
You know, 2007 was the first human-induced pluripotent stem cell. So that's it.
That's
really not very long
in the
ago.
grand scheme of things, you're right. That's relatively
That's
new.
yesterday.
Yeah, that's right.
And certainly for most physicians, you know, if they're in a senior enough position to be into this kind of thing, you know, that was not part of their medical curriculum at all.
Not at all. That's exactly right. And a lot of the immunotherapies right now, the whole immunology world's changed so much. The second major challenge, though, in addition to the whole education part, is reimbursement. These therapies don't fit the checklist for third-party reimbursement, and therefore, who's going to use them? I mean, if you're not going to get paid for delivering the therapy, then it's just simply not going to be used. So I think that's got to really be addressed in a serious way if we're ever going to take advantage of these therapies, because I'd say many of these things are more expensive at the time of delivery than current standard of care. So third-party payers say, wait a minute, why should we pay more when we could go the usual way and pay less? And they don't look at the long-term benefits, because if you're actually curing the disease rather than just treating the symptoms, downstream you're going to save a ton. That's not real obvious, though, to third-party payers.
I mean, this has been a recurrent theme already in this Congress, the problem of reimbursement. And I guess you're in the same place that, say, electric cars are, because while there's relatively small volumes, it's very expensive, and there isn't also an infrastructure in place. And you're in exactly the same place.
Yeah, I think you're exactly right on that. I was just thinking about your infrastructure comment. I think that's true because depending upon your approach, the cell therapies are either going to be autologous from yourself or they're going to be allogeneic from somebody else. If they're allogeneic, where are those cells? I mean, who stores them? Who ships them? How do you have to treat them? So that not every place is set up to do that. So what we don't want to happen is develop therapies where there's only, a couple of places in the country that can deliver it. We want these things, these types of therapies to be available to everybody, which means they've got to be accessible to local hospitals, local treatment centers.
So here in the Congress, we've got a complete smorgasbord of advanced therapies, stem cells, cord blood, regenerative medicine. What's exciting you that's in the Congress?
I think it's I don't think. To me, what's finally happening is a recognition that, let me start over. I think that, I'm going to put it a different way. We've been doing stem cell therapy for a long time. As a matter of fact, just this morning I was on a website called clinicaltrials.gov. Typed in stem cells, clinical trials. Would you care to take a guess how many clinical trials that came up? Take a high guess.
A high guess, 1,200.
3,000. 29.
Wow.
So 3,000.
So while we've not been looking, it's been mushrooming.
Well, but the significance of it is, if you ask any group of physicians, say, name me one disease where a patient walks through your door and you now routinely treat them with stem cells because it's better than the standard of care. The answer is none. It's zero. So you ask me what's exciting. To me, what's exciting is there's I think an increasing recognition of the reasons the current approaches with stem cells, for example, don't work. And now that we've recognized some of those things, we can fix them. So I think the advent of effective stem cell therapy is very close, especially for specific diseases. We recognize that you just can't take a stem cell, manipulate it as much as you want outside the body, stick it into an abnormal myocardium or brain or whatever and expect it to turn into a normal cell and replace tissue. It just doesn't work like that. So how do we change that? And I think there's now an increased recognition, not just on stem cell biology, but all the things that allow you to deliver it effectively. That is exciting from someone in my position. I'm a physician. I want patients to get better. Yeah, that's exciting.
And any particular developments in the field that, not necessarily that are here, but that in the last year or so, which you think are particularly significant?
Well, there's this is not going to be an easy answer. What I do for a living involves highly interdisciplinary activities. So you can't take one specialty, a cell biologist, for example, and make it all work. You need immunologists involved because there's always a host response to whatever you put in. You need biomaterials people involved, and typically these disciplines go their own ways. And working together, they recognize that even though they each might not have all of the answers, together they do have some answers. And so one of the most exciting areas to me is the whole advancements that have been made in the field of immunology.
Yes, immunology is very hot at the moment, isn't it?
It's amazing. When I went through my education and training, the immune system existed to fight off disease or to repair damaged tissue, and there were neutrophils and macrophages and lymphocytes, and that was not much more than that. You had the adaptive immune system and the innate immune system. Now we know that the immune system is absolutely essential for development of normal tissues in fetal development, for maintaining health, not just fighting off disease. its role in cancer and all of the immunotherapies for cancer is just remarkable. You take a species that normally regenerates everything, like a newt, you can cut off a whole limb, it'll grow back a limb. You block one inflammatory cell, a macrophage, and it doesn't regenerate anything. What's an inflammatory cell? What we've learned as an inflammatory cell had to do with regeneration. So we're getting a whole new look at the role of immunology in regenerative medicine. And I think that this has been a really major advancement. It's already contributing to the immunotherapy that's occurring for a lot of diseases, arthritis, cancer, and so forth. So I think as a general area, it's probably that has been the most, I'd say, exciting, most effective over the past year or two.
All we have to do is understand what immunologists are talking about. Because they talk in this strange language, don't they? But anyway.
They do. And it's hard to get immunologists to blast out of their discipline and realize how much they have to contribute. They're interested in their little cell, in this little pathway, and if you could just say, but that can cure this or that, they say, don't bother me. I want to figure this pathway out.
Well, so that'll be our mission. We've got to get immunologists.
Yeah.
And so if you're an immunologist and you're watching this, we're
right.
very, very pleased to have you at Advanced Therapies Congress
right.
next
Come
year.
see me. That's right.
Meanwhile, thank you very much indeed.
You're welcome. Thank you.